morning, everyone. I'm Megan Culp, along here with Scott Michlin.
Good morning. It is Thursday, November 5th, week 33.
Yeah.
And I'm going to keep the music going so we know that little baby Pena is still dancing.
I know.
Right?
For listeners who did not see that post, one of our loyal listeners has a little one, a toddler, and she was just going to town on the theme music.
She loves the theme music. I know, right? So here you go.
She's got moves.
Yeah.
Just for you, baby Pena.
There you go. Okay.
It's just cute. We need a little cuteness.
We
this
do.
week.
We should. And, I'll maybe cue it up for Monday. We can have her dance along.
Oh, yeah. We'll have to ask her mom.
If that's
yes.
okay.
Yeah.
Okay. We'll see how that goes. But yeah. So anyway, welcome everybody. It's great to have you with us. We are here. And as I said, week 33. And we got some great guests coming up because cases are increasing in our state, in our county. And so we want to provide that information to you and kind of let you know what's going on. But we'll hear from the chief of staff from the hospital today. Also, some folks from Basin health companies are going to be calling in to talk about how their jobs are shifting and changing just a little bit.
Yep.
Right? You know about that.
I do.
Because that's the other hat that you wear in the community these days. So,
yes.
So thank you for setting that up. And so that's the program today.
Yeah.
So there we go, right? So let's get started by talking a little bit about the numbers that we see and testing for first of all, and talk about what's coming up tomorrow here at San Juan College. Again, 8 to 9:30. The health department will be offering free COVID testing. We have not seen the schedule for next week, but I assume it's probably that same Monday, Wednesday, Friday. But we'll fill you in on Monday's program when we get the schedule, but I haven't seen it out yet. And of course, all the other info about getting registered for a COVID test on Friday or next week. 327-4461 is the number to call, or the state's coronavirus hotline at 855-600-3453. Mm-hmm. So that's happening tomorrow here at San Juan College again. And then we could talk about Johns Hopkins numbers. They've been tracking this since the beginning.
Yes. So confirmed United States cases are at 8,638,127. Confirmed United States deaths are at 233,777. And right behind us are India, Brazil, and Russia. Of course, they have mammoth populations, but we also know that Western Europe is struggling. I know Britain's shutting down for a month again.
Right. That's true.
Germany.
Yep.
Not having a good time.
Nope.
Scandinavia.
Nope.
Not having a good time. So,
right. So we're seeing increases all over.
Yes,
all over.
We're seeing what was predicted, which is winter is going to be rough.
Right. And so that's...
and, you and
scary.
I were looking at a news article just yesterday that the highest confirmed cases so far happened within the past 2 weeks.
Right.
Which I feel like we're so tired of it that we might be missing that information, the
That's
sobering reality of it. So
very true. Well, let's go to our first guest who is on the phone right now, and we will get them on the air here. And good morning. You're on KSJE. Thank you for calling in this morning.
Morning, Scott. This is Bob Underwood over at San Juan Regional Medical Center. How are you this morning?
I'm well, Dr. Underwood. Thank you for calling in. We appreciate it, and we're hoping that you've called in with a little bit of an update for us on how conditions are over at the hospital. What can you tell us?
Yeah, absolutely. As I think everybody knows, across the board, we are seeing an increase, certainly through the state, and we're starting to feel it more here in San Juan County. The information that was put out by the Department of Health yesterday shows us to have one of the highest increases in a per day increase of positive cases, really going all the way back since late June, early July. So that there are certainly more positive cases that we're seeing. Currently at the hospital itself, we have our ICU has 3 intubated patients that are COVID positive, and overall we've got 22 patients that are COVID positive. That includes those 3. We have 2 patients that we're still waiting for results to come back on. Now, that's not the hospitalizations that we were seeing back when it was, really, really busy here. Nonetheless, these are increases that we are seeing across the board. So our total hospital census, in other words, all of the patients we have in the hospital right now, is 137 currently in-house.
Thank you. Interesting.
Great. And just a quick follow-up on the ICU thing. How many total beds are in the ICU?
So normally we have a 14-bed ICU. We currently have 8 patients in that ICU. Only 3 of those are actually on ventilators right now. Now, when I say currently, that's because back when we were really full a couple of months ago, we actually converted what we call our PCU, which is kind of a step-down unit between an ICU and a regular floor. We converted that so that it is capable of being a full-on ICU. Currently, that one is full, but those are not COVID patients. There are 9 beds in that PCU area, and all 9 of those have patients in them. Only one of those patients is currently on a ventilator.
Understood. And Dr. Underwood, I suppose then folks there at the hospital, you've always had, I think, these plans to have to expand if you need to, if you see this surge in patients coming in, that you've got room to expand. You just mentioned the secondary kind of ICU area there at the hospital, but this is kind of what the hospital's been working on and been having available almost since this pandemic began. Am I correct?
Oh, absolutely. And you go back to March, April, when this first started, we started making those levels of contingency plans and contingency care models back then. So we started converting floors to be specifically available for COVID patients. We also have areas where we can do telemetry monitoring, that we've expanded that capacity. We've worked on airflow so that we decrease or eliminate the risk of cross-contamination. We've done all kinds of things at the organization, and the benefit is before we even had a patient here that was COVID positive, we had really started working on those contingency models, and now we've had 7 months, 8 months to really work on it and make sure that we're ready for whatever comes next. And the other component of this, if you remember back when we had our really big surge back in April and May timeframe, we were transferring patients out because we didn't have the room to put patients here on some circumstances because we had a big surge. Not as bad as what they were feeling maybe down in the Gallup area, but we certainly were feeling it up here too. We're kind of in a different position right now. In other words, we have capacity. And so as other hospitals may reach their fullest, we take transfers in. This has always been the case. We transfer patients in off of the Navajo Nation, extending out in Carinta and other areas. We also take patients in from Shiprock when they don't have room or capacity to care for those patients. And we're still in that. We still transfer patients in when we have space to put them, and we do have space right now.
Great. And I want to switch gears a little bit because the holidays are quickly approaching. And so usually there is a lot of cross gathering, other family members from out of town, etc. We saw Gavin Newsom in California put out some requirements of no longer than 2 hours and no more than 3 different families, etc. So I wanted to ask our local health officials, what are some suggestions for these holidays that are fast approaching, especially since our cases are already on the rise?
Megan, you're dead on that one. Those are going to be concerns, and in a lot of ways, they cannot be completely avoided. I, for one, have a daughter who's in college, and the college shuts down over the holidays, and it's an out-of-state school, and so she will be traveling back here during the holidays. And so, yes, taking appropriate precautions are absolutely necessary. Trying to maintain social distancing. Do not, I think Dr. Fauci said he's going to be celebrating his Thanksgiving via FaceTime and trying to do it in as much of a remote way as possible. And limiting out-of-state travel as much as possible, of course, is very recommended, and even within the state. We in San Juan County are being affected by an increase in the number of COVID cases, but other parts of the states of our state are feeling that more than we are, and so the risk of that cross contamination, to use the term, certainly is a risk. So the things that we have said all along, when you can, wear a mask, wash your hands, and we do recommend quarantining after that level of exposure, but we understand that there's not 100% way to prevent that, as my example kind of showed.
Right. And, some have been saying, well, what if we get tested the week before so that we have the results right before we go? And which brings up another question that has been circulating around testing. One is there's a handful of different ways that these tests work, throat swab, nasopharyngeal, et cetera. Is there one that seems to be more accurate? And B, what about the stories of false negatives and false positives?
Sure. And so there's one company, it's called Cepheid. Theirs is a PCR, polymerase chain reaction, which really looks at the RNA sequence, getting a little technical here. It is the most sensitive and specific. Sensitivity is, if it's there, how good is it at catching it? Specificity is, if it's positive, how accurate is it that that's really what it's detecting? So sensitivity and specificity are things that we look at. The PCR test is still by far the standard. There are others that look at antibody, which is how your body responds, and it produces antibodies against the infection. We can check for that antibody. It's not as good. And not as accurate. And there's also some question of, okay, what do we do with that information? Just because you have the antibody, does that mean you're actually immune? Most of the understanding of infectious disease and immunology would say that you are, but there's documented cases out there of people getting reinfected, even though we know that they've already been infected once. Not a lot of that out there yet, but research is still being done. Science is really is an accumulation of evidence over time, and time is the thing that we haven't had a heck of a lot of in the grand scheme of things around COVID. There's also antigen testing. Again, not going to be as specific as the PCR testing, which actually, we like to put it in this kind of term, it's kind of like a barcode. If it follows this very specific sequence of RNA nucleotides, then that's actually what it is. So long and short is the PCR test is by far the best kind of test to find out if you are infected. That really shows that the virus is present. The other component of how accurate it is how well did somebody do the swab? In other words, was there an adequate enough sample so that when they run the test, there's enough of the substance there to run the test on? So all of those play into it. Now, the state, New Mexico Department of Health, some time ago was saying that if you got a test within 72 hours of coming back into the state and it was negative, that you could continue on without quarantine. They have removed that caveat. So they no longer consider that necessarily a safety buffer in terms of whether or not you may or may not have or be carrying the COVID infection.
Great. And what a rapidly evolving situation, which is also a race against the clock as more and more people come down with this.
Yeah.
And I, for one, love it when the docs get technical and break it down for us. I'm nerding out over here. But Dr. Underwood, thank you so much for joining us this morning and providing such valuable information.
Anytime, Megan. I appreciate the support that you have given to San Juan Regional Medical Center and to our community as a whole. The more information that we can get out to the public, the better prepared our public is going to be for whatever may come. We don't know exactly what that future looks like. We definitely see a trend going back into the increase in infections. And we're also starting to talk about, okay, when a vaccine is ready, how are we going to distribute it and how are we going to get it out there? And it's really exciting. The last time I talked to you guys, that wasn't even on the horizon, really. We knew it was lingering out there, but we're actually starting to plan the logistics of how that's going to take place. We don't know the timing on it yet. We know it's getting closer, but, like you said, it is rapidly evolving. And professionally, it is a rewarding place to be because I never thought I would see this. Professionally, it's still very concerning because I never thought I'd see this. We talked about the next pandemic when I was in medical school, and that was an untold number of years ago. And here it is.
Here we are. That's right.
Yeah.
Interesting. Well, Dr. Underwood, again, we thank you for your expertise and for sharing it with our audiences today. Thank you so very, very much.
All right. Thank you very much, Scott. Thanks, Megan.
You bet. Nice to talk to you, Dr. Bob Underwood. He is the Chief of Staff at San Juan Regional Medical Center, our guest here on KSJE. And you're right, we were nerding out a little bit, weren't we?
Oh, I love it.
You do.
I'm obsessed.
Gotcha.
I'm obsessed.
There you go. Very good. Well, that brings us to our next round of guests, who
Yeah.
are people that you know.
I do. I love them dearly.
From Basin Health Companies, and let's get them on the air right now. And let me push a couple of buttons over here to do that. And good morning. You're on KSJE. Both of you, thank you for calling in.
Good morning, Scott.
We should have the voice of Vince Moffett.
Yeah, Vince Moffett
morning,
here.
Scott.
And Deon Brown, right?
Deon is there too.
Paging Deon.
There you go. Turn your radio down, gentlemen.
Yeah.
But
Well, I can tell you, I don't have my radio on, and Deon and I are at different locations, so I'm not going to try to throw him under the bus, but...
that's okay.
I'm just going to subtly throw him under the bus.
Please,
Yeah, exactly.
please don't. But
Good morning, guys. We're really glad to be here, for sure.
we are happy to have both of you on the air this morning. We appreciate it very much. And we wanted to get you on to talk a little bit about some of the changes that you're seeing at Basin Health Companies. And I know Megan has been kind of working on that along with the rest of you all over there.
Yes. So we've had a surge in cases nationwide, including our state and including our county. And so when that occurs, just like in the beginning, we talked to you guys pretty early on, Vince, about what you had done to protect patients and healthcare workers, including administrative staff. And so give us an update on that stuff.
Sure. Well, so, luckily, we did a lot of prep in the spring to get things ready. And although, just like a lot of people, we were able to, we saw a decrease over the summer. It was great, but we never really changed our protocols. And so our COVID fatigue is definitely pretty heavy right now. And unfortunately, it's going to stick around for a while. So we have done, just like the hospital, probably you've heard them say, is, recommit to stop the spread. Just let everybody know that, hey, look, we're still in this. We're starting to see the issues of COVID positive and COVID, contacts where people, either their family members or friends have COVID. It's affecting our workforce from the quarantine stance. So, I think professionally, we're still staying the course, but trying to get all of our employees and the community to recommit to these issues, because it's putting a strain already on the workforce from both the medical side and I think probably others in the community as well. And I think just getting everybody to realize that, what we said from the very beginning, this is a marathon, not a sprint. And when I said that in March or April, I really didn't think that a marathon was going to be a year long. I think just, personally, even being in this field and being involved in disaster response is hard to comprehend. But here we are several months later and starting to see this surge again. So I think everybody in our community, and I think our staff especially, important for our patients, but just to make sure that we recommit to keeping people healthy, keeping our workforce, able to go out and to perform care, wearing the proper PPE. And then one of the things I just would like to point on, I had a talk recently with someone in the restaurant industry, and we were talking about mask and some of the mandates and the confusion and frustration around them. And they gave me a really good example of, not only are there people out here that are still vulnerable, there's healthcare workers, there's patients, there's people with immune compromised systems, stuff like that. But we have employees that are exposed to everything day in and day out with no choice. So, they use the example of secondhand smoke. They said, when people used to smoke in the restaurants and bars, it bothered the patrons maybe, but they were only in there for a short period of time, where the employees were there for 8 hours a day, 5 days a week. I think that's true right now. I mean, we need to keep these people working. We need to keep our clinicians working. So I think it's really important for people to remember that, this mask issue, however they feel about it personally and what they believe, what they're reading online or whatever, there's a reason those mandates are in place, and we definitely want to keep our employees and our businesses and our healthcare workers working for as long as we can.
Great. And this question goes to you, Deon, because yesterday you and I had quite the training experience, which involved a can of Barbasol. So I was talking to a friend last night, and they're like,
Go on.
Wow, that's different. And it's probably not that different. It was just different for me. And so maybe you can tell the general public what kind of training and the intensity that goes into that is involved.
Yeah, Megan. I'm just getting underneath the bus. I'm getting out from underneath the bus now. So, no, honestly, I appreciate everything that Vince has done and what he's, and able to team up with Vince and Basin on what we're doing here at Basin. But to answer your question, as far as yesterday's training, this is something we're doing with all our clinicians. We've even teamed up with San Juan College as far as our nursing programs. We're testing them, and so what you and I did yesterday is just kind of a really short version, but basic 101 PPE testing, and we use shaving cream to kind of reiterate as if the virus was the shaving cream, and just how easily it spreads amongst the different parts that we're taking our gloves off, or we're taking our gown off, or we're adjusting our mask, and where, if the shaving cream was the virus, and just where it spreads to everywhere we go. And so I think it was a good lesson. I think we had fun about it, and it was interesting to see you get all gowned up and ready to go into the fight with all of us. So it was cool.
Interesting. And so maybe paint the picture for us, if you would, of what so you had shaving cream, and then you had to maybe get PPE on and off without getting the shaving cream all over? Is that what we're talking about? Yes.
Yeah. So basically what we did is, as if you were to go into a facility, or you're going to go into your house, a house that was positive with the COVID, or presumed positive, we gowned up. It's called donning. So we donned all our equipment up, which consisted of an isolation gown, a cloth gown, hair covering, an N95 mask, a surgical mask, 2 pairs of gloves, and shoe coverings. And don't ask Megan about the shoe covering incident, because actually you should probably ask her off the air, and she can kind of spread
We'll wrap up the show with a nice classic funny.
Can't wait now. Okay.
And so they basically, how you put that equipment on, or that protective equipment, and then you go in and take care of your patient, or do what you have to do inside that environment, and then leaving. But what we did is, once she got the whole gown on and got everything donned on, I just gave her some shaving cream to kind of just put on her hands, as if she only touched the patient that was presumed positive with the shaving cream. So it started on her hands, and it ended up pretty much everywhere. And so kind of the side joke was that she smelled like Barbasol. So,
yikes!
Didn't mean to make it primarily about me, but that is an example of how clinicians are trained. And I think I did have a little bit of a Barbasol scent throughout the day. But...
Well, I was going to just say, as your co-host, you smell like that every day anyway. So I don't know what's the difference.
Thanks a lot. I don't have to shave my face, just so that everybody knows. Okay, Scott, do you have a scintillating follow-up question for either of these two gentlemen?
I always have a scintillating follow-up question for either of these two gentlemen, but I will defer to you.
What?
My co-host.
Okay.
Yes. But thank you, Deon, for explaining that to us.
Yes, and we are totally cognizant of what is public information shared from the Department of Health at this juncture and what is not. But is there any new information, particularly as it pertains to congregational settings?
Who do you want to answer that?
Either one.
All right.
This is Vince. I'll try to take a stab at that one. We actually were on a call with the Secretary of Aging and Long-Term Services this week, and we work with a lot of these different agencies. I think the biggest one is the amount of testing that we have to do of our clinicians, and that they do of their staff as well. Based off what the numbers are, in the past, everybody that worked in these facilities, including our staff, would have to be tested once monthly. And now, because the cases have increased, we are now to a point where we're testing weekly. And I think one of the things that's really important, and I wish I could get people in the public to understand who aren't involved in healthcare, how extremely stressful that is for the people out there. I know people in the oil field are getting tested on a regular basis. Healthcare workers are, school teachers are on a rotation, but the more we see in cases, the more that those are working in these industries are having to be tested. And if you haven't received a test, it's not horrible, but it is uncomfortable, and it's not something that's fun to do on a regular basis. So if we can keep our cases down, hopefully that will keep those numbers down. And what that means is there's less spread and less cases out there, and we're protecting those people in those homes. It's extremely important to make sure that, we're limiting our risk of taking COVID into facilities. And one of the things that, you were just talking about, the Barbasol training, and I love that training because it's really great to see how easy it is to spread germs. And Deon mentioned COVID, but one of the things I'd like to stress out is, by taking these steps, we're actually reducing the chances of flu. We're reducing the chances of cold. And, our immune systems are still being built. I mean, we're not going to crash our immune systems through this system. I mean, we still have those intact, but we're doing a better job of preventing the spread of cold and flu and COVID. And so these steps, as the COVID cases rise, you're also probably going to see, more flu or more cold. If the cases are going down, it means we're doing a better job of stopping it and slowing it down. I should say, not stopping it, but slowing it down. Not only COVID, but flu and cold. And those things are also extremely hazardous for these people who are immune compromised and elderly and in these high-risk groups.
Very good point, Vince Moffett from Basin Health Companies. And again, that's why we're hearing a big push for folks to get their flu shots this year, in addition to all the other things that are going on. We just don't need folks getting sick with the flu and overwhelming our hospitals with flu and COVID patients and things like that. You mentioned, of course, this ongoing, and we've heard again about the hospital making plans to distribute the vaccine when it becomes available. But here we are, and it looks like there really is not a definitive end in sight. And so as you make plans for 2021, Vince Moffett, is it a lot of just stay the course and be vigilant and things like that? I mean, how are you looking at next year now for your companies and your employees? Is this something you're going to be pushing through mid-2021, you think?
Yeah, I hate to say this, but yes. I mean, I think that the big thing for healthcare workers and what we're going to continue to see even after a vaccine is distributed is this intense use of protective equipment and, procedures to keep these patients safe, because not everybody's going to get the vaccine. There's still going to be some things that are unknown about it. So, and we don't even know, like you said, I mean, I was on a meeting this week and they said, okay, the vaccine is expected to arrive sometime between November and May. And I was thinking, well, we're already in November and that's a big gap of time. So yeah, that's all we've got to do. And I think that's, once again, it's a very exhausting process, but that's what we've got to do. And we are committed to do it. And it's not the most exciting thing in the world. You don't really see the impact you have, like you're saving lives through doing it, but we really are. And, another thing that we did at our office, and I'd encourage people, to continue to, is to be prepared for, things that you saw in April and May. I mean, we made sure that we have a long running range of supplies so that if the supply chains get shut down again, we're not going to be short of medical supplies or office supplies, and make sure that we're ready for the winter, the unknowns. I mean, this year has been crazy. And I saw something the other day that said, hey, welcome to November, level 11, Jumanji level 11. And that's what it feels like. It's like this month or this year has been full of unknowns. And I think this winter, all we can do is continue to stay diligent, continue to take steps to protect those around us and ourselves, but those around us. And that's what Basin's committed to doing and keeping this high level of protection for our patients and employees.
Great. And Deon, this is our last question for you both here. Why don't you tell us a bit, because most people who are not in the biz do not know about the PPE mask recycling, the N95 mask recycling?
Sure. Yeah, so when this first started, the pandemic, basically the emergency management office set up a contract. I guess it's probably nationwide, but it's called Battelle is the name of it. And basically ours is our reconditioning site is in Rio Rancho. So we take the N95s, we take the and check them out to our staff. They're fit tested, so they're properly fitted, so that they know exactly which brand they work. And then they wear them for a 6-week rotation, once a week, once a day for the week, and they do it for 6 weeks, and then they bring those masks back in, and then I ship them off to Rio Rancho, and then they get reconditioned. We can do that up to 3 times, and every step that it takes to get reconditioned, they mark it and I mark it, and then we just trade back and forth. And so we get our N95s back, and then we're a site, and then they send them back to me, and then I distribute them back out to the employees and stuff. So that kind of preserves our PPE, our N95 masks that we have. And then we've also, Vince has always been very aggressive with making sure that all his clinicians are taken care of with the proper PPE. And so it's just another step that we're taking for this marathon, or going into Jumanji level 12 and 13 and beyond. So
you're ready for that.
And yeah, could I just add, Deon, I think one of the things that really I think the public needs to know is if we didn't have to recondition masks and reuse them, we'd win it. And everything we're doing, though, is because there still is a shortage of PPE, because everybody in the healthcare industry is having to use this and wear it every single time they go into patient contact. And our system that we use still provides the ability to protect the clinician and the patient, meening CDC and OSHA requirements. And I think, a lot of times people are like, well, that's not safe that you're wearing a mask, all day, or, things like that. Everything we're doing has been proven, and we've been doing it for months. And if we could have an unlimited supply of masks in this industry, that would be the best case scenario. But unfortunately, we've come up with a system, and it works, and it's safe. And when we get beyond this, I think, we'll go back to being able to wear a mask on and throwing away like we used to. But unfortunately now there's systems that are in place, and they really are. I have complete confidence in them, and we've worked through them, and we've helped develop these protocols as well. And it's really interesting to watch it work, but it's exciting too,
Yeah, very good. Well, Vince Moffett and Deon Brown, thank you so much for joining us to give us a valuable update. We really appreciate your time.
Yeah, thanks, guys.
Yes, thank
really
you,
good
guys.
talking to you.
Thank you, gentlemen. We appreciate it. Stay well, stay safe. Again, Vince Moffett, CEO, Basin Health Companies, and Deon Brown, also with Basin Health Companies, joining us this morning. So good information.
Great information.
And of course, the stuff that they're talking about with the PPE and testing and recycling as much as you can, or reconditioning is the better word, is going on from multiple organizations, not just Basin. I'm sure the hospital's dealing with this, the nursing homes are doing this, the other facilities in our county and our state, all over the country, are doing the same type of thing.
And it certainly is true that we see results. Those who follow the guidelines strictly have better outcomes. So it is tested, both anecdotally and scientifically.
Very true.
So,
Very true.
You want me to wrap up with my fun story?
Well, I will, but I want to look at numbers real quick, because we really haven't gotten. We got to some numbers, but we haven't gotten to all the numbers. You talked about the Johns Hopkins numbers, and because we're seeing an increase in our state, and I definitely want to let folks know where things stand. Yesterday, another 1,022 cases in New Mexico. We're now at above 50,000 since this whole thing began in March. San Juan County had the highest number that I've seen in quite a while, 52 new cases yesterday being reported, for now a total of 3,964. 14 additional deaths in our state yesterday. One of those was here in San Juan County. And we had another 332 recoveries, which is always a reason to celebrate as well. We're grateful for those recoveries, but these other numbers are really, really high, and they're throwing all the metrics that the state is using to shut down, reopen, all those things out of whack. They're above all those things, at least the daily case numbers. And the governor has another update, I believe, this afternoon to update the state on where things stand. But if you take a look, These are the numbers, of course, from the state on KSJE.com. I want to also point out the Navajo Nation. 131 new cases yesterday. That's the most we've seen from the Navajo Nation in weeks, if not the highest daily report. 12,080 cases now. No additional deaths on the reservation. But if you click on that story, the Navajo Nation is now confirming community spread in multiple communities throughout the reservation, including communities here in San Juan County like Shiprock. And so, again, just beware. There's another curfew, another lockdown on the reservation this weekend that will continue to try to get a handle on this. And then Farmington Schools, of course, continues to report anytime a staff member or a student tests positive. We post them when those individuals have come in contact with others. If they've been at home and have not been in contact with anyone else, then we usually don't post that information, but the school district is still sharing it. We're just not publishing it on our website. So that is the difference there. But I did want to share some of those numbers because we are seeing increases throughout the state and even in San Juan County as we've been kind of watching it over the course of the last few weeks. And then the final thing I want to share is the graphs that we get from the Office of Emergency Management here in San Juan County. So again, these are averages over 7 days, and so it kind of these kind of averaging the numbers kind of takes out some of the dips and hikes and valleys, if you will, peaks and valleys of the daily numbers. But here we are. The pink number is state of New Mexico, COVID-19 cases. You can see why that's so concerning to our state. It's still on an upward trend and higher than it was back at our earlier peak in the state of New Mexico back in late July, early August. San Juan County is the blue line. And again, we are grateful that our numbers are still relatively stable and low. And the Navajo Nation is the green line. You can see it kind of going up a little bit there in the very last few weeks here in November as their cases start to increase a little bit. As we look at the other graph that's released as well, that's a little more focused on San Juan County, our cases and our deaths. The yellow line is San Juan County cases. You can see it dip down a little bit from an average of 145 to an average of 133. So it did come down a little bit, but with yesterday's number, it's probably going to either go steady or maybe up a little bit for next week. Our number of deaths, though, is still gratefully down 110 last 3 weeks. And so, again, we're grateful for that number not being any higher than it is. But every loss of life is a tragedy.
Yes.
So that's the latest numbers. And again, we thank our friends over at the Office of Emergency Management in San Juan County for compiling these each and every week so that we can share them with you.
Yes.
So now we're ready for either the booty story or the mink story.
I can share both.
You have both, right?
I do.
Do we have time for? We have time for both.
Sure,
oh, yeah,
sure,
of course.
sure.
I'll make time. Affiliates, we're going to run over. I'm just letting you know.
Affiliates.
Here we go. What's
All
going
of our
on?
sponsors.
Yes. What do you start with? Booties?
Yeah, sure.
Booties.
Sure.
Okay.
Booties.
Booties.
Shoe coverings is probably a more appropriate terminology because
Okay.
you still have your shoes on.
Right. And this is something that people use, right, when they're going into other people's homes and other places just to, again, part of the PPE uniform, I guess, that you're now wearing, right?
So probably most people have seen them on surgeons, maybe, if
Sure.
you've gone in for a procedure like that. And it's those same things. It's just like hair coverings you see in, cafeteria lines. It's just applied to your shoe. Well...
Yes. Go on.
Well, when I first started wearing these, I was very confused about why they weren't fitting properly. I was having problems getting them over my boot, and so I'd walk in and it was sort of half on, half off. It was very unsuccessful, and
Okay. And I'll just confirm to the audience that you do not wear clown shoes.
no.
Your feet are normal human-sized feet.
That's right. So that
Okay.
was my concern. So
Yeah.
I went back to the office with my colleagues there, and I was like, what is going on? I'm a size 9 in women's. Like, surely there are clinicians with bigger feet than mine. So are there different booty sizes? Or is this shoe coverings like gloves, small, medium, large? What's going on here? So they asked me to demonstrate, so I put them on. And then one of my colleagues said, wait, do that again. And then she was like, you do realize there's a slit in those, right? That you stick your foot into the hole
Oh.
and that covers your foot.
And shoe. Mm-hmm. How are you putting them? Are you wrapping them around your?
I was just kind of like trying to
Okay.
finagle it.
Oh. Well, now you know.
Yeah. So that is
Okay.
a funny, that was office humor for quite a bit.
I bet.
On occasion,
Right.
it still comes up.
Yeah, you're now off the shoe covering committee, probably.
Yeah.
There.
I mean, there's been, a number of guffaws and blooper reels since starting when it comes to me. And so, yep. So that's the shoe covering story.
Okay. Well, now you know.
Now
so
you know.
now you can get in and get out probably like that, right?
That's
Couple
right.
seconds.
That's right. So
No shaving cream on your
on
shoe
my
coverings.
shoe coverings. Yeah. So, this is a vulnerable moment for me on air.
Thank you for sharing.
Mm-hmm.
Thank you for sharing.
The second story involves, we haven't had an animal story in quite some time.
No, we haven't.
So
right? That's true.
We have a new one.
New one.
And it involves minks.
Minks of
The-
the coat variety.
That's right. They aren't just walking coats, let's be clear. They are cat-like creatures.
Right.
They're like fancy cats that
Yes.
have really soft coats. So some
Right.
people wear mink scarves and things.
Well, we used to. I don't know how much of a demand for
don't
mink
know.
is anymore.
Well, in Scandinavia, apparently it's quite high.
Okay.
Because
What's going on?
Denmark had to cull 17 million minks. To cull is actually to separate, of course. That's the dictionary definition. Now, once they're separated, we can only imagine what happens. I don't really want to get into that because we have
Right.
sensitive sensibilities here.
Sure.
So, but
There's going to be a sale on coats.
but we might have a very high supply of mink coats these days.
Because
They are infected with and spreading COVID-19. And the big concerning dynamic here is not just that there's, one more source of spread, but it's that it's a mutated form in the
Right.
minks. So there's a mutated COVID-19 virus in the mink population. And with in Denmark, but also in Spain and also in the Netherlands.
Oh.
So
Okay.
it's not just in Denmark, it's in various countries where mink farms exist. And the most concerning element of this is that the spread of this mutated virus can impact the ability of the vaccines that are being developed.
Because this virus has been mutating since we discovered it, right? It's been changing a little bit, but this is a major change that would then impact the vaccine that's now being developed, the different vaccines to fight it.
Yes, it can
And that's
impact
the problem.
the body's ability to develop antibodies.
To this particular strain of the COVID-19 virus. So that's why we don't like the minks.
Yes, so our vaccines our vaccine development is in danger because of the minks. So yeah.
Which is why they're being called.
Yes.
I'm
so
sorry,
I wouldn't
but yeah.
say that I've never been categorically opposed to minks. Usually I'm categorically opposed to bats, but
Right. I'm pretty minks neutral myself.
yeah.
But
The
in
bat
this case,
opposition actually stirred up some controversy that I was not expecting.
Interesting.
So I've
Okay.
kept my animal bias at bay and
right.
have been publicly silent on
Okay.
my opposition to
But you're-
various species. But the minks are they are
Get rid of 'em.
infected little buggers. So
Yeah. Well, I'm sure as they look into this, they're figuring out how it mutated and how it changed.
Yeah.
But at this point, I think they just don't want it to spread any longer
Yeah.
because we really have put all of our kind of eggs in the vaccine basket. And whatever the vaccine is, if there's multiple vaccines or what have you, great. But we don't need a mutated virus then to come back and make all that not.
I mean,
right?
it's not dissimilar. The only thing that's different, of course, is that flu vaccine has been established for a long time. But, when you get your flu vaccine, you do see that bottom part that's only to be filled out by the clinicians, and it has 4 different boxes to check, and they're all different vaccines which involve different mutations. So we don't, really know what's going on. But so anyway, so that's the story. So
Interesting.
we still haven't found
Okay.
the missing animal link. We don't really know which animal is responsible yet of this zoological virus, but for a long time that was the assumption that eventually we'd have an animal to human virus that would cause some problems, and here we are.
Here we are.
So
Interesting. Okay. Thanks for sharing the minks story.
the minks.
There you go. All right, everybody. Well, thank you for joining us, everyone. We are about out of time.
We'll close it down on that note.
I think we probably should, but we'll be back on Monday with more information. And, of course, we always post all the latest numbers on our website, ksje.com, of course. And we appreciate you watching and sharing this important local information. That's why we do it. Mondays and Thursdays on Facebook and YouTube, live every morning at 9 on Mondays and Thursdays, and a rebroadcast at noon on KNMI. We appreciate their support. And KSJE Radio every afternoon, Monday and Thursdays at 5 p.m. So stay well, stay safe, and we'll see you back here
See you
on
Monday.
Monday, everybody. Bye-bye.